Welcome back to Ivy Unleashed. Today is a very important day. We are talking about something we have not talked about. And it is very important. And Brooke is kind of signaling, if you're watching on video, what we're going to be talking about, her beautiful pearly whites. We're going to be talking about the mouth-body connection today, which is so important. It is so underestimated how much this affects our health. And we have the perfect person here today. We have a biological dentist in the house. We have Dr. Toni Engram here. Welcome to Ivy Unleashed.
Thank you so much for having me. I'm excited to join you guys.
I feel like a lot of people listening are like, what is a biological dentist?
Yes.
And when I was in the midst of my health journey, I was working with a holistic practitioner, and she was like, have you had any mouth work done? And we were talking about parasites and the link with getting my wisdom teeth pulled and parasites. And that's when I first heard of just this practice of biological dentistry. So will you just dive into that first and foremost of what is that?
There are a lot of names that all kind of overlap. So biological dentist is one, holistic is probably the easiest to grasp what it's really talking about. Some people will say functional dentist, biomimetic, but all basically we're looking for the root cause. We're trying to eliminate toxins, whether that is hidden infections or materials that maybe were not helpful for the body, and making sure that we're supporting the overall health of your body through your mouth.
Wow. Okay. And I'm so curious how that is different than the standard, I don't know if you would call it a Western medical doctor or dentist. I'm not sure how you would kind of differentiate the difference. Like if I'm just going to go to my dentist in my town here, what I would normally find. So what's kind of the difference between you and the dentist that most people go to?
The normies, as we call them.
Normies?
The normies. So I would say, again, it's really being intentional with the materials that we use. So I don't have any fluoride in the practice. I filter it out of the water as it's coming in, and we source our materials to make sure that they don't have fluoride, and also that they have as few other toxins as possible. When we're talking about dentistry, it can't always be natural, because we're trying to mimic what God gave us to begin with man-made materials, but we can still source them as cleanly as we can. And then it really just is, focusing on prevention first instead of just jumping right to treatment. We talk a lot about nutrition, and we're really taking a whole body approach. So I would say fluoride is a big one.
Let's talk about fluoride. Can we talk about fluoride? Because I'm so confused, because your whole life you're like, oh, let me do your fluoride treatment. You got to come in here and do your fluoride. You want to make sure you get the toothpaste with the fluoride.
And then you become an adult and they're like, oh, get the fluoride out of the water.
Yeah. And you're like, wait, what's wrong with fluoride? So can we just start at the basics of like, what is fluoride? Is it bad for you? Is it good for you? Do you need it? Do you not need it? What's your take on that?
So confusing. And right now it depends on who you ask.
Mm-hmm.
So what I was taught in dental school is that fluoride is beneficial for everyone. Really, the benefit of fluoride is the topical benefit. So we know that when your teeth are exposed to fluoride, the teeth get harder. They get more resistant to decay. What is less convincing now is that it really doesn't have a whole lot of benefit when we're talking about taking fluoride internally. The systemic benefits are just really not there. So I have less problem with fluoride in toothpaste than I do with fluoride in our water. So I would say if we're talking about, how to make baby steps to minimize our exposure to toxins, then I would absolutely start with water. And when I say toxins, when I call it a toxin, there's a reason for that. Is we know that at certain levels, fluoride is not good for us. there's more and more evidence, and this is peer-reviewed evidence. It's not just the opinion of all the crunchy granola folks. It really is research-based that we're finding that there is an increasing risk to our children's IQ when moms are exposed to more fluoride, when babies are exposed to more fluoride. So I think over the years, we really were oversold on the benefits of fluoride, and we underappreciated the risk involved. So that's really where we stand. And that's why so many people now, and you see it in the news a little bit more now, especially with the administration and the Health and Human Services, um, we're really focusing more on getting it out of the water, because when it's in the water, you can't control the dose. And if you're drinking water from any municipal water source, you really don't have the ability to control if you're getting it or not.
It's so true.
That
You
makes
have no idea. Yeah.
So ethically speaking, and in my opinion, it's medication without consent, because people are not able to consent on whether they get it or not. It's in the water, so it's in everything. That means if you're drinking a can of Coke, if you're having packaged food, anything that's made from a municipal water source is going to have fluoride in it unless they're taking steps to filter it out.
So how do we control that besides like just getting a water filter? And how do you know if your water filter is actually filtering it out, you know?
Yeah. So you're right. It stinks that if it's in your water, and you can always either, look at your own municipal water supply, look at their website. You can go to, I think it's ewg.org, type in your zip code, and you'll be able to tell there what all is in your water. But if it's in your water already, if it's in your water supply, then the only way to get it out is to filter it. And the most reliable way to filter out fluoride, because it's a very small particle, is with reverse osmosis filtration. So having some kind of reverse osmosis is really the only way to make sure that you're getting it out.
Okay. And I've heard of that a lot before. Is that the main purpose for having reverse osmosis, is for the fluoride? Like, is that why most people are getting it?
I think so.
Yeah.
Okay. So fluoride is a big one. So when people come into your practice, what type of toothpaste do you recommend?
I really am so encouraged over the last few years, because there are ingredients that are way safer than fluoride, have a much better safety profile, that are still effective. That's what we were missing for the last several decades, was something that could compete with fluoride in terms of effectiveness. So now we have ingredients like calcium hydroxyapatite. That's the big one. And then things like xylitol, which is a plant-based sweetener. And if it's done in the correct form and the correct amounts, it really can be as effective as fluoride at reducing cavity risk.
And this is for kids, adults, everyone.
Anybody.
Okay.
Anybody. Yeah.
Is there a brand that you like?
I like a lot of different brands right now. Again, we're very, very fortunate in that it's more readily available. So you can get it at, Amazon. Any health food store is going to have good versions. Ones that I keep in the office right now is Risewell. We use one called Fig. And then Boca is another one.
Okay.
Never heard of those.
Nice to have some names. We have so many questions, and I want to talk about just overall health with your teeth. Like, I think people underestimate, if you have pain in your mouth, it's going to okay, I got to get to the dentist. But we underestimate taking care with the
Oral health
with the flossing and the brushing, and how that affects our digestion and our microbiome. And so can you talk about how everything's kind of interconnected and why we got to focus so much on these teeth?
Oh, man. Our mouth is so incredibly unique that it's really pretty amazing. So it's the beginning of our digestive tract, for one. It has its own unique microbiome, so it overlaps a little bit with our gut microbiome, but the the bacteria in our mouth are in large part specific to our mouth, and we can control that with diet, with supplements, with bad habits. We can influence that microbiome and really impact our digestion from the first part of our digestive tract. But then it's also the beginning of our respiratory tract, which is not what we want. We want it to be our backup system to our respiratory tract, but it's our backup system. And if we're not able to breathe through our nose, then that can be our secondary way that we breathe. And it's a direct influence on our circulatory system.
Ooh.
So all of those inflammatory cells, if our gums are inflamed, then we're inflamed. It's so interconnected with the rest of our body that we just can't separate it. And it's really a shame that whoever it was back forever ago decided that we should have separate schools of training, because we did, as a society, we separated dental health from overall health. And that was really just a huge mistake and a disservice to all of us.
Yeah. I want to talk about bacteria, because obviously there's good bacteria and there's bad bacteria. And we got some mouthwash people and we got some anti-mouthwash people. And, when your kids have I have some kids that have had cavities and some kids that haven't. And I know that everybody's different. So I want to talk about, is mouthwash necessary? Does it help with cavities? And also, why are some people more prone to cavities than others? And is that related?
Yes, definitely related. So with mouthwash, I try not to be dogmatic about anything. So back in the old days, when I was out of college, trying to get into dental school, I worked for a year as a dental assistant, and they would have these big bottles of Listerine on the counter by the sink. And in between every patient, I was trying to get into dental school. I didn't want to be the girl with bad breath working at a dental office. So after every couple of patients, I would go to the sink and I would swish with a little bit of Listerine. That was not a great idea. Now I didn't test my microbiome back then. I didn't know what that was back then before dental school eons ago. But what that can do when we're overusing, especially these alcohol-based rinses or rinses with really strong antimicrobials, is similar to antibiotics. You'll knock out the bad stuff with the good. And with some of these, they dry out the saliva. They are highly, highly acidic. So you have those two things involved. And yeah, maybe you're killing some pathogens, but you're actually increasing your risk of cavities by using mouthwash like this all the time. So that's not the way to go. What's great is that there are a few people online who have started screaming from the rooftops that, hey, mouthwash is not what we thought. It's not the end all be all. But the unfortunate part is then it becomes all or nothing.
Mm-hmm.
And I think the message of all mouthwash is terrible and you should avoid all mouthwash forever, I think is maybe throwing the baby out with the bathwater. Because I do think there is a time and a place for some mouthwash. We don't want to overuse it. I don't like the ones that are alcohol based, but there is a time and a place. So I will strategically have patients use mouthwash depending on what their salivary test looks like. What bacteria are we actually seeing in the mouth and what's going to be most effective to remove it. And then we have them use that mouthwash for a specific period of time.
Like when you have an infection or something, to make sure there's not.
Sort of. But when we're talking about gum disease and tooth decay, these are not infections that you feel or see necessarily. So yes, it is an infection, but we're just trying to knock down the bacterial load, and then we'll build things back up with an oral probiotic. For tooth decay specifically, then we will a lot of times use a different type of mouthwash, one that has xylitol, some baking soda. So it's going to have a high pH. The xylitol is going to help shift the microbiome and make them less likely to get cavities over time. So that can be useful, but we're being strategic with the ingredients. And if we're using something that's harmful to all bacteria, then we're balancing that with what we do afterwards.
So someone comes in with a cavity. What is your approach as a biological dentist?
So my approach, for one, is to, again, try to get to the root cause. So we'll start with, what's the lowest hanging fruit? Are we doing things with our diet that are clearly not helpful? Because sometimes that's the case, especially for kids. If we've got somebody who's drinking soda, then we've got to address that first before we try to do anything else. Soda for cavities is kind of like smoking and gum disease. Like, it's rare to see one without the other. So we tackle the lowest hanging fruit, and then we start digging in a little bit more. We'll look at other areas of their diet. Are there a lot of fermentable carbohydrates? Is there anything that we really need to remove, or can we just focusing on adding in more nutrients and supporting the body with healthy proteins, healthy fats, making sure that their diet is optimized that way? We do look at hygiene. Hygiene is one part of your oral health. It's not the end all be all, but it is an important part. And so we're looking at, are they brushing effectively? Are they brushing with the right things? Is there something that we need to do to tweak what they're doing at home with their teeth? And then it's getting them hopefully on a remineralizing toothpaste, so something with hydroxyapatite. And typically I'll put them on a therapeutic level of xylitol, which, therapeutic level of xylitol sounds like a prescription, but it's the easiest prescription ever, because most of the time the xylitol products are gums or mints or candies. And so if we get them exposed to xylitol 5 times a day, then you have those levels that can compete with fluoride at reducing cavities. So those are kind of the big steps that we go through.
So you're not actually removing or doing anything with the cavity. It's more so supporting so the body can do its thing with the cavity. Am I understanding that right?
The body doing its thing is the first step and the most important step. But we do have to do restorative dental work at some point. Mm-hmm. Now, I'm probably more conservative than some of my colleagues. So if there's a cavity that's forming in the enamel, it's still in that outer layer of tooth and it's very small, then we do our best to try to get those to remineralize and heal on their own. We can use, added things to that, like a hydroxyapatite varnish that's a little bit stronger than the toothpaste. So we use a chemical called silver nitrate that we can apply to some areas. We do a lot of ozone. So those things combined with what they're doing at home, we hope can get some of those spots to heal. But if it's past the enamel into the dentin, then doing some type of dental work typically has to be part of the equation too. Otherwise, the source of the bacteria, the cavity itself, is going to just perpetuate the problem.
Okay. And if you grew up, anytime before the 2000s, you've got mercury fillings in your mouth. I know as a kid, I did not take great care of my teeth. I had all kinds of fillings growing up. And
did you have a lot of soda?
No. I had a lot of like gummy candy, I think, and like sour candy, chewy candy. My parents weren't like always making sure I brushed my teeth, those types of things. So let's talk about fillings. And, when do you actually do a filling, and what are the dangers of all of these mercury fillings that are probably in a lot of our mouths?
And mercury is such a potent neurotoxin that they are not without risk. And we were taught otherwise in dental school. So it's really interesting. Have you ever heard of Mad Hatter disease, where people in the old days, they would shape hats, these felt hats, and they used mercury to do it. And so knowing the dangers really back then, they would use their bare hands. They were inhaling the mercury vapor. And so a lot of these hat makers would go crazy. And so when you hear the term Mad Hatter, the Mad Hatter from Alice in Wonderland, that's where the term came from.
Ooh.
Is this exposure to mercury really did cause neurological issues in people that were overexposed. Well, in dentistry, a similar type of situation. So it used to be that dentists, especially before the days when dentists wore gloves, so the 80s, I think, is when that changed. So if you were a dentist before the 80s, obviously you were using mercury fillings because that's all that there was. And they found that dentists really did have more neurological problems later in life than the average population. So the Journal of the American Dental Association did a study a few years ago, like maybe 5 or 6 years ago, and they presented it as a celebration. But to me, it was so telling because in the study, they were celebrating the fact that because of our better mercury hygiene as we were caring for these fillings, they had taught us better practices for disposing of the leftover fillings, gloves were worn, those sorts of things. They were celebrating the fact that from the 80s to the 2000s, like, 2010-ish, that yay, dentists only have slightly higher mercury levels than the general population. But in my mind, I'm, a young dentist. I'm a mom. I worked through 2 pregnancies. That did not sit well with me. That still, after all of our better practices for handling these fillings, we still have higher mercury levels than the general population, higher than those who eat large amounts of fish. So there was still a problem. So thankfully, there's a couple of organizations, really the people who led the way before me, who said we need to be better at handling this carefully. If OSHA were to come in and inspect dental offices, they probably would not like what they find if they actually came in and measured for mercury levels at typical dental offices. And so one of these groups, the AIAOMT, it's a group of biological dentists, they came up with a protocol to protect not only the patient from exposure to mercury, but to protect the doctor, and even more importantly, to protect the doctor's staff. Because you have assistants in the room and doctors in the room and everybody who's exposed to mercury vapor in the dental chair. And so that's what most biological dentists, the ones who are practicing in integrity for biological dentistry, are using this protocol called the SMART protocol. It's the Safe Mercury Amalgam Removal Technique. And this protocol gets as close as we can to minimizing and hopefully eliminating the exposure to mercury vapor that's going to happen when we remove these out.
I mean, it's wild to me that people are dentists, you've got these institutes that are helping with the vapor and all of these levels that are causing neurological issues, but yet we're putting them in people's mouths. Like, make that make sense.
It really made a lot of sense 100 years ago.
Yeah.
It made a ton of sense because we were all eating more organically. We were eating in season. We were exposed to far less chemicals overall. So our toxic buckets were not nearly as filled to the brim as they are now. And these fillings are, for one, they're simple to place. They're inexpensive. And they actually will repel some bacteria because of the mercury. Like, the bacteria is smart enough that it's repelled from the mercury in the fillings. The bacteria is smarter than we are a lot of times. What we found over time is that, when we thought, what I was taught is that once the filling is placed, that the mercury is bound and it can't go anywhere and it's sort of locked in and chemically different. But we see now that anytime that filling is exposed to heat or friction, you will have some mercury vapor released. And so that's why removing them is such a big deal, and why we have to be so careful is because not only are you getting a tiny exposure to mercury vapor anytime you chew or grind your teeth or brush your teeth or drink hot coffee, but if I take a high-speed drill that's going, 800,000 RPM, and I take that to that filling, then we're getting this huge, huge exposure to mercury all at one time with no protection whatsoever if we're not using those specific protocols.
Okay, this might be a dumb question, but when I'm thinking of mercury fillings, I'm thinking of like the metallic, like silver fillings. I have all kinds of things in my mouth. I have had root canals, I have crowns, but all of any fillings I have now are all white. Is that different than the mercury fillings that I'm like imagining them to be silver?
Yes, very different. We call them composite fillings because it's a composite of glass and plastic particles.
I even have an implant in my mouth. What? I've an implanted too. I have had all of it done to me.
You have more than your fair share.
Oh my gosh. I have been in so many dentist chairs that it has not gone well. Definitely malpractice things. I've had some really tough issues, and I want to talk a little bit about that. I mean, I have a lot of questions for you, and we'll get into more of those, but people have dental anxiety, right? They really struggle getting there. And I understand why. I've had so many terrible issues. When I was a kid, my dentist would definitely work on me before I was numb and was not sensitive to me being a child in there. It's wild how some of these people function. But I've also had the most incredible dentist. The one I go to now, I cry happy tears almost every time I go because I'm like, I just can't believe how great you take care of me. And so let's talk about the anxiety of going and, how you how you would suggest people overcome that and how important it is to make sure that this is something you're prioritizing, even if it's really anxiety provoking.
Absolutely. And this is a huge topic. And one this is where the term biological dentist is not my favorite around this. I think integrative is a more accurate term, because we don't want to, a lot of people will ask me, oh, since you're a biological dentist or since you're a holistic dentist, does that mean you don't use any medication? Does that mean you won't get me numb? And that's not the case at all, because I think even more so, the type of patients that I see are more than average distrustful of dentists and healthcare providers in general. I think the patients who tend to come to us have already been burned by healthcare in some way or another. Around COVID and all of that, there were a lot of hurt feelings, a lot of lost trust in medicine. And so I think taking a really careful approach, one that's integrative, where yes, we're trying to minimize interventions, but we're also really compassionate. And sometimes compassion means we're using all of the medical pharmaceutical tools in our toolbox to be able to make an experience better. So yes, for anxiety, we have the whole gamut of options, whether it's complete sedation options to where we just have really nice, easy, gentle conversations face to face. But when we need to do dental work, you get to nap through that. All the way down to the other things that you're doing awake that involve no pharmaceuticals at all. Like we have a device called an alpha stim device. It stimulates the alpha waves in the brain to help you feel more calm and relaxed.
Ooh, that's cool.
You gotta give me one of those.
a PEMF device that we use, a beamer device that can help with, just help stimulate that vagus nerve to get us into parasympathetic, to get us more calm, relaxed, and able to do what we need to do in the chair in a healthcare environment. And then obviously just being human and listening. I had an old school dentist in the 80s too when I was a kid. There was nothing that was gentle or calm about it. Like I really remember as a child how huge his hands were and how big of a burly grandpa dude he was. And people come to me with just really, really heartbreaking stories of things that hurt, things that didn't go well, a loss of trust. You're in a very vulnerable position in the dental chair. So yes, it's a huge issue that we work really hard to help patients with. But also like it goes both ways. Really, just like you found a dentist that you trust now, that's so amazing. That's helped you change your mindset around dentistry. I would encourage anybody, if they've got some anxiety, to whatever that looks like for you, to work on mindset issues, pray ahead of time, do breath work ahead of time. Because if you go into the dental office with distrust, with high anxiety that leads you to be irritable, then the dental office is going to feed off of that unintentionally. And the experience isn't going to go as well as if you come in with a grateful heart, with a positive mindset that things are going to go well, that everyone is there to help you. It just really makes a huge difference in outcomes, I think, with any area of healthcare.
Yeah. And I mean, based on what you just said, you can tell you have a very integrative approach. And that's what I think is so beautiful, not just dentists, but doctors. And our world is leaning more towards that. And maybe I'm biased because of what I consume media-wise and all that. But I do think the world is leaning more towards this. We are recognizing the link, the importance. I do think there is still situations that come up, toothaches, or people can't get in and they need those quick fixes, the over-the-counter. So in those cases, as a biological or integrative dentist, what do you recommend for those cases?
The quick fixes. Well, this shocks a lot of people who haven't been into my practice, but I still prescribe antibiotics when it's needed, Now, again, I'm more conservative than a lot of my colleagues with it. A lot of my patients will take it. They'll take the paper prescription, and I know they don't fill it, and they'll use essential oils and homeopathy and stuff on their own. But I still, like, the drugs, the procedures are still sometimes needed and necessary, and sometimes the best option if we're in a bind. And so the ultimate quick fix, if there's a toothache and it's like that throbbing, wake you up in the middle of the night kind of pain, then you better believe I'm going to prescribe you an antibiotic, because I would rather you take an antibiotic and have to deal with the microbiome issues on the back end than have you wind up in the emergency room. Because I've seen that too many times. And I've had that happen to my patients too many times.
Have you ever had an abscessed tooth?
Mm-mm.
I have. My whole face swelled up during my bridal shower.
Oh my God.
Yeah.
Gosh.
Not
Isn't
good.
that awful?
So awful.
So there's no like creams or anything like that. I just see like the over the counter products. There's so many out there. So would you tell people kind of
like an Oragel?
Yes.
Oragel. I just don't. Even for something over the counter, I just don't know that Oragel is all that great. That like the numbing gels, they'll numb the surface, but they don't really numb much else. So it's probably not going to hurt anything if you're an adult using Oragel. I don't want you to use it for your kids for teething. There's actually some risk involved with doing that. But for an adult, it's probably not going to hurt anything, but it's also probably not going to help very much either. Like I would say, if you need a quick fix like that for a toothache, then you could do clove oil. So clove essential oil is helpful. It can also do some numbing too. And then good old ibuprofen.
Yeah. Is there anything else when it comes to diet, lifestyle that we haven't really talked about that you're like, okay, this really helps prevent cavities. This would really help just like oral health in general that we haven't touched on?
Really tons of, I think we touched on it a little bit, but high quality, healthy fats, because most of the minerals that our teeth depend on are fat soluble. So getting those fat soluble vitamins and getting lots of good healthy fats to absorb the vitamins that you're taking in.
So fish,
really
nuts,
helpful.
seeds, avocados, olive oil, all that good stuff. Okay, cool.
All that good stuff.
See, you don't think about how fat soluble would affect your teeth or your microbiome. You know, I mean,
Like nutrition in general. We hear candy and sugar.
yeah.
Sure. But yeah, and people will ask, specific diet programs. I've seen lots of things work. The only things that I would say are really challenging if you're struggling with cavities specifically, is I see people have a lot of challenges keeping a healthy mouth with vegan and vegetarian diets.
Why do you think that is?
If that's you, if you're vegetarian for ethical, religious reasons, then it takes much more careful planning, maybe some supplementation to to really change the microbiome and make sure that your teeth have the nutrients that they need to stay healthy. If you don't have any issues with animal products, then like Paleo, Weston A. Price Foundation, like ancestral type of diets where it's, I think you can have some grains and still be perfectly healthy. But really getting tons and tons of vegetables, good, high quality animal proteins, I think is really where you get the most bang for your buck.
Why do you think that animal proteins help so much with your teeth?
It's those specific nutrients. I think making sure that you are getting the vitamin D and K2, and you're getting the benefits of whatever that cow ate in the protein. So it's a much more complete protein. Whereas with the vegan diet, you're having to piecemeal things together. You don't typically get complete sources of protein unless you're pairing your legumes and your grains correctly, and then you're hopefully soaking them to get rid of the anti-nutrients. It's just they're a complete protein. They're more easily absorbed, and a lot of times more easily digested.
So fascinating.
I love it. I feel like I could ask you 1,000 questions.
I know, we have more.
So if there were 3 top takeaways, what we call our gold stars, one of our last 3 segments, what just top 3 takeaways would you leave our listeners with today?
Wow, I love this. I would say top 3 takeaways are, number 1, dentistry and your dental care should be safe. The second is that your oral health is essential to health. And the third and most important is that our bodies are designed to heal and flourish.
Ooh, those are good.
I love that last one.
Okay, next up is Unleashing Ivy questions, things that we're curious about. And mine just has to do with my personal experience. I've had many root canals. Shocker. I've had them all done. And I want to know, I don't even know what a root canal is, why I had to have a root canal. I've had many of them. And I know that there's a lot of chatter about this. And so I would just love you to riff on what a root canal is, if they're necessary, and what do I do about them now?
Can you say root canal one more time?
Root canal.
I love that. That was like a combination of your Minnesota accent with a little bit of Southern twang in there. I appreciate that.
Yeah.
Root canal. I love this topic because I love that there's conversation about it now, because it's really nuanced. And similar to the mouthwash discussion, I think either extreme is probably unwise. So I don't like extremes. I don't like to be dogmatic, because what's important is that every patient knows what's the pros and the cons and what's best for you and for your mouth. So what a root canal is when, for various number of reasons that would take a while to go through all of them, but for whatever reason, the nerve of the tooth is either dying or dead or infected, and is either causing pain, but not always, or the infection is leaking out into the bone surrounding the tooth. So that's why a root canal is typically recommended. And what they do is they will go into the root canal of the tooth and they will remove the nerve, and what has to happen is the blood supply of the tooth comes with it. And so what you're left with is this little tube, and the middle part of the tube has been cleaned out, rinsed out with really teeny tiny little instruments, and then packed with a type of filling material that goes into the canal. Now, the problem is that your teeth are not just a tube with a hole in the middle. Your teeth are actually like a sponge. And so we only see easily the one little hole in the middle of the tube, but there's thousands of microscopic little tubes that go out from the main tube. So a root canal is great in that it can calm things down. It can remove pain because it's no longer throbbing inside of the tooth and causing pain. The nerve is gone. It can maintain the structure of the tooth, so you still have a tooth in that place. So you're not having to worry about teeth shifting around. That can protect the aesthetics of the area because you're not missing a tooth. So lots of good functional reasons that it's beneficial to have a root canal. But the problem is that all of those little spongy tubules that run out from the main tube, they don't necessarily get clean and sterile. And now they don't have any blood supply. So the microbiome in that area shifts. And we go from the bacteria that's normally there in and around the tooth to, shifting to those anaerobes that don't like oxygen, because again, blood flow is oxygen. And so you kind of get the little creepy crawly bacterias that start to inhabit the area instead. And for most people, just like mercury fillings, just like smoking cigarettes, with most people, it does okay. And so plenty of people have a root canal or two, or maybe even more, and do just fine. But other people, if maybe their toxic bucket is a little too full, or maybe they're just highly sensitive, for some people, they will notice that they start to have other health symptoms shortly after those root canals are done. Or if there's a root canal that's infected that they just don't know about, because root canals can become reinfected even after they're done. And so that's where the new conversation is, we can't say, as a dentist with a dental license who appreciates my dental license, I can't say that a root canal in your mouth is going to make you sick or have X, Y, and Z health issues. But we see interesting coincidences where health issues start to pop up after root canals are done, or that chronic health issues start to reverse and start to become easier to heal once old root canals, infected root canals are removed. So it becomes this really interesting conversation. There's no black and white. I'm not going to, tell my patient that you definitely should do a root canal for this reason, or you shouldn't for this reason. It becomes very individualized. Like, what is your risk level? Where is this tooth located? Like, are you going to, if it comes down to it and our option is to either do a root canal or pull a tooth, which is a conversation that I have almost every day in my practice, it's not an easy decision for a lot of people. Sometimes if it's a very back tooth and it's a tooth that's not really in function, nobody sees it, they'll say, go ahead and pull it, no big deal. If it's a 20-year-old girl who got hit in the face or was in a car wreck and it's the very front tooth, then it's a tougher decision.
Mm-hmm.
Like, are you going to have the root canal and keep your tooth, or are you going to have your very front tooth missing and then have to deal with the implant or whatever the case may be?
Mm-hmm.
Yeah.
So they're not black and white conversations, but I think all of us, whether, traditional dentists or biological dentists, we need to be having good, open, honest conversations without judgment on either side so that they can make these decisions with all the knowledge that they need.
Mm-hmm. Have you seen similar things with wisdom teeth? I'm just thinking of what you're saying with root canal and people that have chronic health issues that maybe you've tied back to wisdom teeth or something similar.
Yeah, like a lot of times we'll be having conversations, like usually it's a functional medicine doctor or a naturopath who's sending me a patient because they want us to check for cavitations. And that is typically when someone in the holistic sphere is talking about a cavitation, they're typically referring to an area of the bone that just didn't heal correctly after a wisdom tooth or another tooth was removed. And that bone can actually, not only does it not heal, it can become necrotic. And so very similar situation. Sometimes if a patient is trying to get over the hump and get past a plateau with some health issues, then sometimes cleaning up that infected bone, the dead bone in the area, can be helpful and can help just peel back another layer of the onion so they can go on their next step of healing.
Wow. It's just wild, oral health, how many avenues you can go, and just getting to the root literally makes sense when you're talking about the mouth and how many people have had work done and maybe are dealing with these issues. My question, I want to take things a little lighter. So you've heard of tongue scraping. That's a big oral trend right now. Mouth taping. Are there any things like that you recommend? Any fun, maybe rituals, products that people can do to help with their oral health?
I really like both of those.
Good.
I love tongue scraping and I love mouth taping. I would say another fun one that you wouldn't think would help your oral health would be xylitol nasal sprays.
Tell me more.
Every day, especially at night, is a game changer.
For what?
Total game changer. Because not only does it help change the microbiome, so xylitol will work the same way in your sinuses as it does in the mouth. So the pathogens, the bad bacteria, they don't really like the xylitol. They'll ingest it thinking that it's sugar or similar to sugar, but they can't really metabolize it. So over time, it just shifts the whole bacterial balance towards the more beneficial bacteria. In the mouth, it's preventing cavities. When you use it as a nose spray in your nose, and it's just like a saline spray, but it tastes sweet when it goes down the back of your throat, which is kind of nice. It will also shift the microbiome in your sinuses, which will help clear out the nasal passages, help you breathe better. So it'll decrease the amount of mouth breathing that you're doing at night. And then that helps a whole host of other things. It helps maintain good salivary flow, keeps things moist, helps with face shape. When we're talking about kids, anything that we can do to get our kids to breathe through their nose instead of their mouth will actually help them have more room for their teeth and will help them develop a larger airway just by being able to sleep with their mouth closed.
Yeah. Would you say it would help, with the balance of your gut bacteria as well?
It does help some with the balance of your gut bacteria, but there's overlap, but it's not so much that you would want to ingest a ton of xylitol.
Just a little pump every night.
It's helpful. It's helpful up your nose. But I try to steer patients away from just swallowing a ton of it because it's a pretty intense, when you swallow it, it's an intense prebiotic and can cause some gastric distress when you ingest a ton of it.
Yeah. Dr. Toni is also ambassador for the Breathe Institute. So we could have a whole nother episode about airways and spaciousness in the mouth and so many things that we could touch on. And it's all important and so interconnected. And we've had an episode about that too. But I think this information is endless, and it's really fascinating what we can do with our mouth to improve everything. Before we get to our last question, I got to just throw this in here because we haven't talked about it. What helps people have better breath, not raunchy, bad breath? What's going to help us out?
A good microbiome that's balanced. That's first and foremost. Drinking water is huge. And breathing through your nose, believe it or not. Because what causes bad breath are sulfur compounds. So any kind of, if our saliva is too dry, if we don't have enough, anything that dries us out is going to contribute to bad breath. Any kind of inflammation or excess bacteria in the back of our throat and our tonsils, that's going to contribute to bad breath. And then any kind of, excess plaque buildup can also contribute to bad breath. So anything that helps us close, helps us keep moisturized and hydrated is going to be what helps the most.
Oh, so many great tips. Man, you're just full of them, Dr. Toni. I love this. And we always end, two things left, but we have one last question, and this can have nothing to do with teeth. You can answer this any way you want, but we like to ask every guest if you could go back and tell younger Dr. Toni, or maybe not even doctor, before you were Dr. Toni something, what age would you go back to and what would you tell her?
I know exactly when I would go back. I would go back to young mom, new graduate, 2008, back the OG. I would go back and I would tell that young mom who was sick, who was burnt out, who was struggling, who was feeling bad. I would say, take some time, enjoy your baby, enjoy life, enjoy your food every day, take care of yourself. The rest will wait. And oh, by the way, your illness, your sickness, your mess will become your greatest message in just a few short years.
Wow. That's beautiful. I'm so glad that, man, we didn't even really get into your story, Dr. Toni. I mean, you're so full of information that I think it can be life-changing, right? But when we connect to the human behind it, that you have a story of not being okay, and that this can be a route to help people. Can you just elaborate a bit on kind of what you were struggling with?
I was diagnosed with Crohn's disease in 2011, and that really was the best gift that I could have gotten, because it was an unfortunate but a very common Western medical experience. Where I was put on a bunch of medications, told that this was just my fate. There was nothing I could do about it. And in my gut, I knew better. It just took a while for me to figure out exactly what that meant. But as I figured out how to heal from Crohn's disease, because I've been in complete remission really since very soon after my diagnosis. I went into remission pretty quickly, was able to completely heal. And after that, that's what got me into oral systemic health, because they're the same. Crohn's disease, it's an inflammatory condition based on a dysbiosis in the gut. And I treat the same thing in the mouth every day. So I treat inflammation, I treat an imbalance in the microbiome. So if I could figure it out for myself, then I darn sure better figure it out for my patients.
Wow. That is so inspiring. I'm so grateful that you're here and that you followed that gut instinct that you had. I am really bummed that you're in Texas and not in Minnesota, so you can't be our dentist.
We have a lot of people that fly down, so you can always fly down and come see us just for a little bit, then go right back home.
Okay, let's go visit Dr.
Yeah,
Toni.
but if they want to follow you, find you, where can they go? Where could they, ask you a question, email you, follow you? Where can they find you?
The best place, our most active place is on Instagram. So just at Dr. Toni Engram is where you can find me on Instagram, and people ask questions there all the time. Our website, if you want to come visit the practice or just learn about the practice, read the blog, all the things, how we do things a little bit differently, is flourish.dental is the website. And then we have, any other social media channel too, but Flourish Dental Boutique is the name of the practice.
Beautiful.
Awesome. We'll plug all that in the show notes below. And we leave our listeners with a piece of gold. A quote can be your quote or something that you live by, something that you love. Would you please send us off with your piece of gold?
Absolutely. So all healing is first a healing of the heart. And that's a quote from Carl Townsend.
This is Gold Ivy signing off.
Listen to your truth and go chase your gold.
Oh,
I love that.
Thank you.
That was great. Thank you.
Thank you guys so much.
and thanks for sharing your story. I think that's so inspiring to know, a lot of times you look at a dentist or a doctor and you think they have no idea what I'm going through. But the fact that you've been through something that's so challenging, and I loved the advice you shared to your younger self. It was beautiful.